So, to 8 p.m. last night, all was good. We had a total of 5,173,413 tests undertaken in New South Wales. And again, up to 8 p.m. last night, there had been 0 locally acquired cases. 3 new cases were acquired in hotel quarantine, but they were all from overseas. During the day, however, there was the usual swabs, the day swabs that we implemented quite a few months ago now, of all of the quarantine staff. And then late in the evening, there was an apparent positive result of a 47-year-old security worker who works at a number of hotels. The 2 of interest are the Sofitel Wentworth and the Mantra Hotel at Haymarket. The testing is obviously being followed up and checked. Saliva testing, of course, is an appropriate form of testing on a daily basis, but sometimes does have results which need to be further clarified. And of course, that means we do follow-up testing. That follow-up testing has been undertaken, but results are not available as yet. We did think that it was more important that we at least get the news out that there is an issue to do with this particular security worker. The gentleman was so he tested positive yesterday. Normally we would go back to about the 11th, so a couple of days before that, in terms of the 48-hour to 72-hour likely possible infectious period. But in order that we can do a full spectrum of testing, the health people are going back to the 8th in terms of his contacts, and that's obviously being worked through at the moment. There'll be some information that Dr. Chan can give, but there'll be more information unfolding possibly later in the day and earlier tomorrow. I do just want to indicate too that the guard was vaccinated on the 2nd of March. Which is obviously good news, but as you'll be aware, the antibody reaction that's required from vaccination doesn't get confirmed or doesn't achieve its maximum for some time after the first and indeed the second vaccination. So he would be having the Pfizer vaccine at that period, and we would expect that he would be due therefore for another vaccination next week or so. So as we've said all along, vaccination helps, but it doesn't necessarily stop you, and certainly stop you getting the virus. The purpose of vaccination, of course, as you'd all be well aware, is to make sure that when you've had your 2 doses, in case of Pfizer or AstraZeneca 2 doses, it makes you far less likely to get as sick as you would get and far less likely to die. At this stage, then, we are continuing the investigations in regard to the security worker and to his close contacts. Pleasingly, his family at this point have tested negative, and that's a good indication. But until we've done all the necessary investigations and got the genetic sequencing done, it's hard to actually provide any clear indication as to source, which is why the extra time is being done in terms of going back further. I'm going to ask Dr. Chant now to make some comments in relation to it, and then happy to take questions. Dr. Chant.
Thank you, Minister. So probably just to summarise, we do use a routine surveillance of our quarantine workers. We do that on a routine basis. That's a screening test, and it's set to actually throw up what we call positive results, because we don't want to miss any cases. So it's set up at a very sensitive, and so we actually find a lot of false positive or false non-negative tests. So as part of our routine, we validate that with nose and throat swabs. So this result came in yesterday evening. Then thank you very much to the individual. We arranged testing of the individual, and repeat testing came in from memory just in the early hours of the morning, around midnight or shortly into the morning. Based on that, we started to take public health action. The gentleman was immediately isolated and their household isolated when they had the non-negative salivary test result. And then once that was confirmed, our public health team swung into operation. The household of the case, which consists of 4 individuals, were tested this morning, and pleasingly those test results are negative. Obviously we're running them on a couple of different platforms to be extra, to take an extra cautious approach, and we'll update you if there's any differences in any results on that family. In terms of where this person acquired it, as the Minister indicated, this gentleman works in our hotel quarantine systems, generally works on the weekend and does weekend shifts in the hotel quarantine system. So in terms of, he was infectious whilst doing our shift, and so we have contacted around 130 people who worked from 7 p.m. on Friday night to 7 a.m. on Saturday, from overlapping that 12th of March to the 13th of March. We're asking those individuals to immediately self-isolate and get a test, and basically that will allow us time to work through and ascertain the nature of interaction that this security guard would have had to those quarantine workers. We have a system where people do QR codes when they sign into work, and so that presents a very effective way for us to reach out to those individuals, and they will be followed up by a phone call, so that information's gone out to those individuals. In terms of the source investigation, what we're looking for is where this person could have been working at a time when there was a positive case in the 14 days prior to the onset of the symptoms. And what we've identified at the moment, we've gone through all of the cases in our hotel quarantine system, and as you know, we move our positive cases across to our Sydney health accommodation. So we usually have very clear windows when people will have been infectious in our hotel, police-run hotel quarantine. We've looked at a number of those cases and looked at where some of them may have had very strong histories of historical infection. So they're the ones I talk about where I say they're high CTs and they have evidence of immunity and sometimes even previously tested positive overseas, all the way through to those acutely infectious COVID cases. And so what we've identified is that there was a person who was infectious at the Sofitel in the Sofitel Sydney Wentworth, who was present at the time that overlapped a period when this security officer was working, and that's between 7 p.m. on the Saturday the 6th of the 3rd to 7 a.m. on the 7th of the 3rd. So what we have done as a precaution is reached out again to the workers that were at that hotel at that time, because if this person was exposed, we're obviously thinking, could anyone else have been exposed? We are, obviously the easiest thing that will help us identify a source is our genome sequencing. So if we compare this person's genome sequencing the virus that this person has with those returning travellers, it allows us to determine whether they are in fact identical or very closely related. If that is the case, it narrows down and reinforces our working hypothesis at this time that that could have been the exposure event. You can imagine that at the moment we're in a very preliminary phase of the investigation. We are currently reviewing all the CCTV footage, which will again allow us to stand down some people and indicate that no, you wouldn't have been exposed, and it will also maybe give us some intelligence about how there could have been potential crossover, or again rule out this as a source and open up new avenues of inquiry. So I think I just want to indicate we're telling you what we know at this point in time, but information changes and we'll keep an open mind. The genomics is being done urgently, and we're expecting that at some time in the next, possibly very late into the evening or very late into the evening or early tomorrow morning. And again, but we are taking this precautionary approach. In terms of the gentleman and the community exposures, again, we're taking a precautionary approach and assuming that if they were exposed around that date, then they could have been infectious a few days later. Obviously, this person has had no symptoms, and therefore it's very hard to pinpoint the exact period of infectiousness. Now, again, we're taking a very precautionary approach, and I'd like to say that if the community can bear with us, that our information, as new information emerges, we'll be updating that advice. I just wanted to highlight a couple of venues that have come to light in our interviews with the case. And as I said, these will be put up in the website in the usual way. And can I also thank those that have used the QR code system? Again, this highlights that, despite the fact we've had no community transmission, these cases can come out of nowhere. Well, not nowhere, obviously, these risk settings, it has been predictable that we will get these incursion events. But the fact that people have signed into these premises with QR codes and continue to use that really helps us in our public health action. So thank you. The venues are the Bexley Aquatic Centre on Saturday the 13th of March from 9 to 9:30 a.m. Pancakes on the Rocks at Beverly Hills on Saturday the 13th of March at 10:45 to 12 noon. And also a train from Hurstville to City arriving at 6:30 p.m. on Friday the 12th of March, and City to Hurstville leaving at 7 a.m. We will be able to find more detailed times as we get access to that Transport for New South Wales tap-on, tap-off data, and we'll be updating our website. At the moment, we think these venues are low risk, but what again we're doing is reviewing CCTV footage to refine the information, and we will be using that text to those patrons that have used the QR codes for these venues. It is likely that some additional venues will be identified, and also there are some additional investigations and risk assessments being done for a few other settings, including workplace. Happy to take questions.
Any questions?
Which other settings are we likely to see included on the list of venues of concern? Are there any workplaces where the security guard was working since the 8th of March, before the 14th of March, that were not the Sofitel Wentworth or the Mandurah at Haymarket?
Yes, this gentleman does have another workplace, and we're just currently looking at that. The advice we've had is that generally that person resides in an office-based setting, but we are checking with various key cards and other things to track the movements and identify the potential. Obviously, we will alert the public if there's any risk to the public associated with that workplace, but as you can imagine, the staff are just currently working very hard to get this information out to the public. There may well also be other venues, again low assessed risk venues that we will put up, but again we're just doing that work to confirm the times and dates.
So as well as working hotel quarantine, he works in an office-based setting. What's that office?
At the moment, we just need to do that risk assessment, and then we'll be releasing that information.
And when did he last return a negative saliva test?
So he had 2 negative salivary tests on the 5th and 6th of March, and then, as I said, the test result came back positive yesterday evening, very late, and then we repeated that. That is part of the protocol. We do, as I said, these salivary tests are a screening test that allow us to do this daily monitoring. They are set at a threshold where they do throw up non-negative salivary tests, and we have a protocol which involves confirmation testing in the usual way, where we test it using a nose and throat swab.
So because he wasn't working during the weeks, and he works weekends in the hotel quarantine system, his last negative salivary test was on the 6th. But then he wasn't tested again until he went back to work this weekend just gone. Is that...
That's correct, and obviously there is advice around making sure that anyone with symptoms comes forward for testing. There is a lot of awareness amongst the quarantine workers in terms of coming forward whenever anyone has symptoms, and that's critically important. And just can I stress again, this individual did the right thing, participated in the screening program, and has been very cooperative with all aspects of the investigation, as has the family. So thank you very much.
Just in terms of the Hotel quarantine workers, is it the concern more the Sofitel Wentworth, or do you have concerns from the Mantra at Haymarket as well? Are workers from the Mantra also in isolation now?
That's correct. So there's two sort of components. One is we're concerned for two different reasons. Firstly, this gentleman worked a shift, that sort of night shift at the Mantra, and so what we're looking at is what interactions that person had in that workplace with any other colleagues. So as a precaution, we've alerted all those colleagues to get tested and isolate. As we review the CCTV footage, as we interview him in further detail about his movements, it's likely that we'll be able to scale back our action. But the things we look at is whether he's had interaction with anyone really on that evening, night shift. The other aspect of the investigation is the source investigation. So this is where we're looking for how this person acquired the infection. And as I said, the way we've gone about that is by reviewing all of the cases in quarantine and who was positive at a time in the hotels at a time when this gentleman was working. Obviously, we then have to look at whether he was on the same floor as the individuals, whether he crossed over when the individuals were there. Those investigations to date, and as I said, they are in the preliminary phase, have sort of led us to this particular infectious person at the Sofitel on the 6th, which has then led us to pursue that line of inquiry. But as I said, we're also keeping an open mind as we need to in these investigations, but that is currently a possible working hypothesis.
Dr. Chan, he was vaccinated. So forgive the question, but if you're vaccinated with that first dose, does that make you less likely to transmit the virus? Is the virus that you potentially pass on anyway less if you hadn't been vaccinated?
So vaccines are very wonderful things, but they actually take a little while for your immune system to kick in. And sometimes you need those 2 doses to get the optimum immunity, and that's certainly the case with the Pfizer. So we need those 2 doses at day 0, and then we have another dose at 3 weeks later. This gentleman was vaccinated on the 2nd of March. We wouldn't have expected his immune system to kick in for about 12 to 14 days, or potentially a little bit longer after the initial vaccine. And then obviously the second dose of the Pfizer vaccine gives further enhancement to that immune response. In terms of our understanding about transmission, whilst we are still learning how the vaccines impact transmission, but what we would hope for and believe in theoretical terms is that if you are vaccinated, you probably don't have such a high viral load. You know, you're protected against severe illness. Your viral load may well be lower, and therefore it will potentially stop you transmitting it with the same degree. But a lot of this work is still being looked at, and the science is being worked through as we literally speak and have experience with this.
We have no symptoms at all.
No, I mean, we have seen people with COVID where symptoms, they are asymptomatic. The symptoms can be sometimes mild, particularly in people that are relatively healthy. Or so yes, this is part of the reason why we do have the surveillance programs, but we also have that message to quarantine workers or anyone coming into contact with international travellers that it's most important that even with the most minimal of symptoms, you get tested, even if you've been participating in a surveillance program. You really, if you've got symptoms, you need to get that nose and throat swab.
And the nose and throat swab, that nose and throat swab was done after the salivary test?
That's correct. That's correct. So the nose and throat swab, so just to let you know that the salivary testing is done as a screening tool, and then what we do is we confirm that. And as I explained, the reason for that is that we set the ability to pick up the virus at a very low level. Saliva isn't as good a platform as the nose and throat, but clearly is more efficient at putting in place. And it is actually very hard and challenging to get people to have daily nose-throat swabs. So this is a good compromise, but because of that, we have to then validate the test because we've set it so that we do expect to get false positive salivary tests.
So your working hypothesis is clearly that he was exposed to the positive case on the 6th of March within the Sofitel Wentworth, rather than to catch him from the community. How frustrating is it for you, Dr. Chant, and also you, Minister Hazard, that we've had another leak of COVID-19 from the hotel quarantine system?
Look, can I just indicate that hotel quarantine is always going to be associated with risks of transmission. We're noticing that we've got increases in variants of concerns associated with higher rates of transmissibility. We are keeping an open mind and we try and learn from every episode of transmission events and look at how we can further reinforce the system. But this virus is infectious and can be transmitted in this setting. We do everything we can to minimise that risk, and just be reassured that we are committed to finding out exactly how this transmission occurred. And as I said, I just want to stress that this is our working hypothesis, informed by the best available evidence, but we're also keeping a very open mind, and the investigation will change its course if there's information that takes us on a different path.
Minister Hazard,
I've asked you, this is happening now. We are a week away from the beginning of that broader phase of the vaccination process. The timing couldn't be worse or not. What's your thoughts on that?
This is the reality of a pandemic. The science and the medicine can only go so far, but it's a human system. So the message I think out of this is don't become complacent. To those who are thumbing their noses at getting vaccinated, get vaccinated, because there's a real risk. It's a real and present danger for us all, and it will continue until we have most of the population vaccinated, and even then it could continue for quite some time after that. But at least it will be, once we're all vaccinated, we will know we have far less likelihood of ending up in intensive care, far less likelihood of dying. Of course, I think each of us have a moral responsibility to have the jab for another reason. I've seen our health staff, our frontline quarantine staff, actually being put at risk. They put their lives at risk every day, and in so doing, they can expect back from us the very least we can do, which is have the jab, have them both as soon as you can.
Other jurisdictions, I think Victoria from memory, is doing salivary tests of their hotel quarantine workers throughout the week, not just when they are on shift. Why is New South Wales not doing that? Because it looks like this individual has been exposed to COVID last weekend, hasn't been tested all throughout last week, was tested again this weekend, meanwhile has been out in the community for 5-6 days.
Look, the saliva tests are, as Dr. Chant just said, she said they were set low. I put it another way. They are set at a very sensitive level. So they are picking up and doing the job they need to do, but every decision that we've taken here in New South Wales has been predicated on the very best advice. That is from Dr. Chant and her team, and we will continue to accept her advice.
He was exposed last weekend. He didn't have another test until he came back to work this weekend. He's been in the community for a week.
How concerned are you about the risk that this particular gentleman poses to the community? Is there a sense that he has been out and about a lot in this past week?
He's been out and about, but not excessively. So it's certainly a case of just doing what we've been doing for more than a year, and that is working through it. I'm relatively relaxed today, knowing that we have the systems in place that we have, and I'm also relaxed about the fact that the testing did its job and picked up the gentleman. I think the message, though, from this to everybody is don't be complacent. I've certainly seen complacency everywhere I go. Actually, now people have been saying, well, today would have been our 56th day without any transmission. And it's fair to say that everybody, wherever I go, seems to be exercising complacency rather than extreme caution. We're in the middle of a 1 in 100 year pandemic. We all have to take it seriously and know that Our hotel quarantine system is all that stands between us and what's happening in places like Italy with 300 people dying a day, the States, South America. We need to just recognise that we all need to do our bit.
Will, Minister, will this case put at risk the planned easing of restrictions that's set to come into effect from March 17, like drinking whilst standing and other things?
It's far too early to say. As you probably heard, Dr. Chant, I mean, I literally got the email, I think, at 1:36 a.m. this morning, and our health teams are all working through the night. They've been working this morning, as you'd expect. They're just doing what a really good public health epidemiological response needs, working through what we need to work through, making sure that we understand the possible sources, the possible contacts, and we'll do what New South Wales does, I think, the best in the country, and we'll manage it. Sorry?
Did you get much sleep afterwards?
I went straight back to sleep knowing that we had the best public health team in the country managing it.
Are you frustrated, Minister, that another case, another lead from hotel quarantine has broken a 55-day streak of no local transmission? I have always, and the Premier has always said, we have to expect that in a human system there will be vulnerabilities. You'd be amazed every time we stick a finger in the dike, there's another issue somewhere else. Well, that's normal. I'm not at all fussed about that. We'll just manage it, and we'll continue to manage it. I want to thank the people who work in our quarantine system. There are thousands of them working in our quarantine system. They could choose not to work in the quarantine system, but they work there and they do their best to keep us safe, and I think we should acknowledge the work that they do and be grateful for the fact that people are prepared to put themselves at the front line, whether it's security workers, whether it's police, whether it's the nursing staff, the doctors, cleaners. There are a whole range of people. We shouldn't be frustrated. We should be thankful and grateful and know that when they have the tests and these results will come up from time to time, we have the wherewithal to manage it extremely well. Just on the vaccine, right, lastly, the federal government today said, gave their strongest indication yet that they'll be happy for New South Wales to keep the health vaccination hubs open and vaccinating people that would have otherwise been vaccinated at GPs in phase 2A and 2B. That would be something that you would welcome in bringing forward that vaccination rollout?
I think quite simply all of the states and territories have offered to assist in terms of the logistics of the rollout. We're all looking forward to working more closely with the federal government, and I'm pleased to hear that they are accepting our offer to assist. All right, I think that was it. Thank you very much, guys. Thank you.